Welcome back. The Saturday edition of the Around Town TV show continues right now with me, Scott Rogers. Many of you know I live in chronic pain. I'm disabled, all because of my back surgeries, the many I've had over the few years. Joining me now to discussing a very important topic that affects a lot of people in America is pain management. Dr. Gregory Ward from the Baton Rouge General is here with me now. It's good to see you again, Dr. Ward.
How are you?
You're looking fantastic.
As you as well.
Oh, thank you. I like your tie, by the way. Where'd you get that from?
I have no idea.
Well, it says in the Bible, if somebody asks for your shirt, you should give me a jacket as well.
I'll give you a tie.
Oh, I bet you would, because you're such a good guy. You're here today to talk about a really important topic, not just to me, but to many Americans. How many people, statistically, do you think are there in America that live with chronic pain?
Ooh.
It's a huge number, I read.
It's a huge number. I'd say roughly maybe 5 million or more.
And that is a huge statistic, and it affects the economy, it affects it affects the country as a whole. What's the most common cause of lower back pain? Because I also read that back pain is the most common cause of chronic pain.
Yeah, well, the most common in the adult population is degenerative spine disease.
Which I have.
Unless you're Benjamin Button, okay? Then it's a different iteology. And that's in the adult population. In the childhood population, adolescent, it's usually mechanical low back, meaning that it's not necessarily, it's related to muscle group. Okay, as opposed to true spinous dysfunction.
A lot of folks that I've met, because when you have a condition, for some reason you meet everybody else with it, a lot of times it's surgery, surgery, surgery. Is that the only way to deal with pain management?
Well, unfortunately, I think through the course of the education to the public about back pain, most patients who have chronic back pain suffering have undergone surgical procedures, but there's a lot of non-surgical
Could you tell us some of those?
Sure. One is physiotherapy. Non-surgically. The other techniques out there could be, if necessary, acupuncture as an alternative.
And that's been around for thousands of years. And that's got to be for a reason.
Yeah, it works. And of course, there's a chiropractic management. There's prolotherapy, which uses basically glucose and lidocaine and vitamin B12, and it's injected. So it's a non-steroid based treatment for chronic back pain.
When should you, at what point should you go and see a doctor? And I just want to interject with what I did.
Well, sure.
I waited till I couldn't move and couldn't breathe, and I was completely immobile before I decided to call the doctor.
Well, categorically speaking, most people wait until that time, but
it was horrendous, by the way, Dr. Ward.
If you can wait until after you've tried a course of Tylenol, Advil, Aleve, some of the over-the-counter preparations, and give it about 2 to 3 weeks. Then, of course, follow up with that with either some type of stretching exercise program or just walking or some basic activity before you see a physician.
Now, you mentioned earlier about physical therapy.
Yeah.
How does that help, and really, when should you go for that?
Well, physical therapy is the basis of what we use to treat back pain conditions. Even after surgery, you have to have some kind of physical therapy. Essentially, what we're looking for is to help strengthen the core body, abdominal muscle groups, low back muscles, the glutes, the quadriceps muscles, and even chest muscles as well. We incorporate techniques of ultrasound, massage, heat,
I've heard
cold.
about ultrasound, by the way. It's amazing what sound can do. You would never think of it as being a healing tool.
It's been around for a long time.
Now, we've talked a little bit about what we should do, when we should do it. What about what we should not do? Are there any physical activities we should avoid?
Well, you know, that question depends upon the person's lifestyle.
Because I decided not to enter the Olympics.
Well, that might benefit you. For some, it might work for them if they're more active, but it depends on lifestyle. Most commonly, patients or people who engage in activities that they're typically not fit to engage or typically that they haven't done for a while. Lifting, biomechanics is very important in the home setting.
What is biomechanics, by the way?
Well, essentially doing proper lifting, proper techniques
like
of
bending your knees, not bending over.
Correct.
I found that putting the brace on when I know I'm going to be up for a time, I have this like thing around me, it helps to keep me erect and it helps to stop me forgetting. Because you drop something and you reach down to get it and oh, it really hurts.
Yeah, well, the brace is a good reminder of the mechanics that you can't perform.
That's what it does, it reminds me.
So it gives you some protection, yeah.
What are you a doctor of and where do you work? Tell us a little about what you do.
Sure, I'm a specialist in physical medicine and rehabilitation. We treat patients who have painful spinal limb conditions. I have an office, Louisiana Institute of Physical Medicine. I'm also at the Baton Rouge General and medical director of the rehab center there. And I incorporate a lot of non-surgical techniques in what I do during the course of my practice on the day-to-day. doctor. The phrase means educate, so we do educate, or I educate.
You know what, Dr. Ward, that's amazing you said that, because as you were talking, I'm like, you know why I like you so much?
Why?
Is because you explain things in Scott language, so I understand
Well, that's
it.
good.
And you have to go pretty stupid for me to understand something. So I love it when a doctor comes on and I understand everything he's got. I'd like to start having you on more regularly, because I'd like
love to do it.
concentrate and spend a whole session on physical therapy.
Absolutely.
A whole session on body mechanics would be very useful.
Yeah, that'd be helpful. Yeah,
Okay.
Very good.
Thank you, and God bless you, my friend.
Thank you very much.
What a lovely guy, isn't he, Todd?
Yeah. Uh-huh.